Hi, everyone, and welcome to our new episode of Digital Health Inside Out. We were on a small break, and I blame all of that on Sergey, my co-host, who decided to leave to somewhere in Lithuania and enjoy his life there for almost a month, and he wasn't available. But now he's back finally, and we can record this episode and a few others that we're working on. So this is exciting. Today we're going to talk about longevity, but before I introduce to our amazing lineup of experts, I'd like to remind you to subscribe to our channel, like this video, especially if you like this episode, and share with everyone who are interested in longevity and age tech. Also, now would be probably a good time to promote our sponsor. I guess the only problem is that we don't have one. So if you're interested, reach out to us, shoot us a message. So, literally, very impressive lineup. I'm very excited with having all these experts with us. Today we have Sergey Polevikov. Also, we have Hillary Lin, Rahul Mehendale, Igor Korolev, and Alexander Lozano.
You don't have a system that's set up for these companies to succeed.
Did VC bros destroy digital health?
Healthcare is like 20 years behind.
That's so disrespectful.
Any little error could be catastrophic in medicine. Agents is like the story of 2025.
Digital health.
So let's do a flash round of intros, like literally like 20 seconds, who you are, what you do. And at the end of your intro, I would ask you to answer a simple question. What age would you ideally like to reach? I'll go first. I'm Alex. I'm in health tech for many years. I run a tech consultancy firm, and I also have a medical device startup, a device for telehealth. And we're actually working on another product in the space of wellness, which is going to help people with longevity in their lifespan, health span, but it's still in stealth, so I'm not going to tell you more. And answering the question, I think with my lifestyle, amount of stress, and being a multi-time founder, different businesses and startups, I think I'd be lucky if I get to 80.
Hi, everyone. I'm Sergey. My background is in applied mathematics and machine learning. I started out as a researcher in numerical methods and differential equations. And as of 5 years, or maybe already 6 years ago, I moved to healthcare to build something exciting. And right now, I run a startup that builds AI-driven platform for primary care providers and patients. And I also have a Substack, which I think is getting traction. I write about bad actors in healthcare, looking also at AI models in healthcare and looking at various frauds. That's what I'm doing. And I'd like to reach the biological age of 53.
All right, thank you. Hillary?
All right. I want to hear the story behind the 53, but all right. I'm Dr. Hillary Lin. I'm a Stanford trained physician, board certified in internal medicine, and longtime health tech entrepreneur. I'm currently the co-founder of CareCore, and we are a Shopify-like platform for longevity that allows clinicians, creators, and brands launch evidence-based longevity businesses in weeks and not years. So what I would like to live till 500, to contrast a few of the answers before. And why that is, I think it's long enough for me to regret living that long and then come back around and enjoy living again.
I love that. Thank you. Rahul?
Hi, everybody. Rahul Mehendale. I'm a little bit of a disruption bigot and a recovering entrepreneur. So entrepreneurs never recover. I'm currently leading a startup called Live 150. So no prizes for guessing what age I think I would love to live until, but it's 150. The reason being, we've actually added all the longevity extensions from all the recent innovations that startups and larger firms are pursuing. And we believe that somewhere between 120 to 140 for most people is very feasible once we just add those things up. So whether we look at CAR T, we look at some of the supplements and what some of the other researchers are doing around resetting DNA. So those get to about 140. And we believe that 150 is actually the escape velocity. So until we meet that gap from close to 150, Hillary, getting you to 500 and getting others anyplace else is going to be very difficult. But once we touch that 150, it helps us reach escape velocity, and we can go onwards from there. So that's my rationale behind the 150. I ran the future of health practice at Deloitte in a prior life. I also founded a company called MySkin, where we were the first in the world to have figured out how to quantify skin health. Skin, which is our largest organ, didn't have metrics. And Live 150, which I'm leading right now, we provide personalized guidance around nutrition, activity, mindfulness, and sleep to improve health. So if you have diabetes, cardiovascular, so any concerns, menopause, or just you want to build muscle or lose weight, nobody tells you what to do, and we tell you what to do. So everybody just tracks history, and then it's left up to you to hack your way to the best solution that works for you. So we are taking the guesswork out. We built a service which is like a Google Maps for your health. We figure out your destination, and they route you to that destination. So 150, and we'll get you there.
Awesome. Thank you. Hopefully you're going to tell us at this podcast what we should do as well. Igor, please introduce yourself.
Hi, everyone. My name is Igor Korolev. I'm a physician scientist by training, PhD in neuroscience, research focused on Alzheimer's disease, mild cognitive impairment, neuroimaging, those kind of things. I believe in the power of science and technology to improve healthcare, and very passionate about that. Have been on the front lines of healthcare and academic research, but over the recent several years transitioned into industry. Have worked at a couple of top 10 pharma companies, mostly in data science and digital health. And now I work, my current role, I'm a VP of neuroscience and digital health at a company called Cognition, which uses EEG-based biomarkers, electroencephalography-based biomarkers for both clinical care, but also integrating them into clinical trials or drug development. So look forward to exciting discussion.
How long do you want to live?
That's a great question, and I have 3 different answers. I think a bare minimum would be the life expectancy in the US. That would be the absolutely bare minimum, right? So that's about 79 to 80 years old. But I think children should always live ideally longer than their parents in previous generations. So in my case, that would be late 80s, mid 90s. Ideally, I'd want to live 110, 120, 130, with one caveat. I don't want to live with major chronic diseases. I don't want to live with cancer. I don't want to live with Alzheimer's disease. So if I do get lucky and get that extended lifespan, I would want most of that to be good health span. So that's key.
Thank you. And last but not least, Alexander.
Hi, everyone. I'm Alexander. I did my MD PhD, and in my PhD thesis, I studied biomarkers for immunotherapy. So we made predictive blood tests using machine learning and using the immune system to figure out who is going to have terrible toxicities for these immunotherapy treatments. I just finished my internal medicine residency training, and I'm at just the start of my oncology fellowship right now. Currently, I'm working still on some lung cancer research. And then also I've started a small venture capital firm for investing in healthcare and AI companies, just with some of my friends from medical school. In terms of what age, I couldn't echo enough what Igor says. I'll say kind of the same things that we would say to a cancer patient or a patient that we might see in the emergency room. And I hope that I'm alive so long as I have a meaningful quality of life. I have purpose in my life. I have things that make me happy, and that there's really, not too much suffering. But when those things start to become less true, and I think then the equation really changes. So I don't have an exact number, but I think it really just depends on what's going on in life.
All right, very, very cool and very interesting. So before we actually get to my first question, I want to do a blitz round. I'm gonna mention a few different things, and I would ask all of you to do a thumbs up, thumbs down, or like if you think this specific thing does not matter in terms of your longevity. Are you guys ready? All right, so taking supplements. Do you think it's going to help with longevity or? All right. All right. Caffeine. Okay. 6 hours sleep.
Say it again. Sorry.
6 hours sleep.
Is that like a minimum or maximum?
It's
I don't
just
understand.
it's average. Like if you sleep 6 hours a day, is that bad, good, or doesn't matter for longevity? All right. Alcohol. Oh, okay. Darn it. Multiple wearables to track your biomarkers. Okay. Being vegetarian. Okay. Meditation. All right. Regular full body MRIs. Okay. Being a client of longevity clinic. And last, GLP-1s.
Sorry, can you repeat that again, please?
Sure. GLP-1s. All types of different weight loss drugs that are super popular right now. Okay. Very interesting. We're going to talk about most of these things today. My first question, why now? Over the past few years, the number of publications about longevity increased rapidly, number of podcasts, number of VC firms focused on longevity and age tech. As an example, global investment longevity companies more than doubled to $8.5 billion in 2024, which is 220% year on year. So what shifted? Is it better science, demographic panic, brand marketing, or my personal hypothesis, and you obviously can disagree with it 100%, but I think baby boomers, who are the wealthiest generation nowadays, and right now who are aged somewhere between 60 and 80, they don't really want to die. With all that money, they invest so much in research and different longevity practices, and that's why there is this hype in the space. What do you guys think? Why now?
So I can kick it off, and I did a pretty comprehensive study, while I was at Deloitte and leading the future of health practice. I think a couple of reasons. So number one, there's a shift in mindset in the population out there. So if we look at a prior generation, our parents, for example, they thought that they could go to a physician and a physician would fix them. And the mindset from that has changed dramatically as you start seeing the younger people. So younger people are saying that I don't even want to go and see a physician. If I go to a physician, that's actually a sign of failure. And that is a dramatic mindset shift that's happened in the market. So that's number one. Number two is there are the incentives. People have realized that the incentives are not aligned with keeping people well. So it's funny that the world of healthcare is neither about keeping us healthy, nor is it about care, right? It's profit maximization may actually be hurting the world of healthcare. And we are seeing the impact of that. So what's happened is consumers are saying that, hey, the incentives are not aligned to keep me healthy. Nobody really cares or gives me guided advice to keep me well, right? So everybody profits from having me sick. So the incentives for pharma, the incentives for medical device firms, providers, so on and so forth, is always to have a sick population. Surprisingly, even payers, because payers' premiums are as a function of the risk. Because I was talking to one of the CEOs of the top 2 health plans, and he's a very good friend, and he said, "Hey, Rahul, hold on, this is how we make our premiums. You start improving the health of the population, our premiums go down, and no CEO is going to sign up for it because the market rewards revenue, not profitability." So very interesting. So I think there's an incentive challenge, and so consumers are taking control of their own health, which is why we have seen this explosion of wearable devices. So whether it's Fitbit, Apple Watch, Pelotons, diet apps, you name it, sleep trackers, you start adding all these things up. Consumers are paying real cash to take control of their health and stay well. And that's, again, that goes with the mindset change, the incentives, and the control of health. So I think those are the 3 key elements that the market has realized, which has led to an explosion in terms of consumers spending money, and thereby, research, thereby VC dollars into longevity, thereby interest from a lot of players, and having billionaires spending $2 million a year for their health. It's good marketing. So it also helps further support the tsunami that's starting off in the world of wellness.
I'll jump on that as well. And I actually think that there are about 3 or 4 additional factors as well. One is the COVID pandemic really opened our eyes to the importance of our health, and it simultaneously improved access to telemedical solutions. Those of us who have been innovating in this space, we're like, this has been around for decades, but it wasn't mainstream until quite recently. And the advent of actually effective medications like GLP-1 agonists is groundbreaking, because it's enabled people to feel like doing something about their health actually has a noticeable effect. A lot of people are willing to pay for healthcare when they know that there's going to be actually some value gotten from it. People don't like paying for healthcare because they don't perceive value. So, and then finally, I think a lot of the attention is due to 2 parties. One is from the Silicon Valley crowd. I live amongst this ecosystem. I'm in New York now, but they're all my friends, and a lot of folks, founders who have been successful and are now wealthy in the technology space, they're biohacking their way towards longevity. And so that's one big crowd of people focused. And the other is creators, health and fitness and wellness creators, influencers have long grasped the attention of the public. And now it's just become this total force. As a doctor, I know that most of the people out there, they're listening to influencers who aren't necessarily physicians. Definitely, they're not turning to their PCP because no one has a PCP.
Should we trust these influencers? Hillary, what do you think?
Wow, I live in that tricky world. There's influencers is a big, big crowd of people. There are some that I think are very legitimate. They do their research. They're the best science communicators out there. And then there's some that are spouting a lot of harmful pseudoscience and just misinformation. And so I don't think you can treat them all as one group. I think you really have to look at the individual.
Hillary, I'm yet to meet a single startup who's made money on longevity in Silicon Valley. So I think it's a lot of hype, a lot of talk, but VCs are not walking the walk, unfortunately. And not to mention, prevention. I have a spreadsheet of startups, both private and public, and nobody's even talking about prevention. And to me, and I think to a lot of scientists, that's the number one thing that affects longevity. So I think there are a lot of hype, and I think a lot of factors that you mentioned, Alex, initially, baby boomers are retiring, and pharma industry probably noticing that, of course, and they want to make money of that with some so-called longevity drugs. A lot of them are not FDA approved. But again, we need to kind of separate hype from reality.
I think there was, first of all, I think all those things are super interesting. And there are a few things that I found very interesting that I came across in the past few months. One is I was giving a talk about, how do we measure longevity and the biomarkers for longevity. And I came to realize that, the life expectancy across the whole world, but particularly in the United States, has really flattened out. So you had this kind of sigmoidal increase in life expectancy where it was flat during the medieval ages. It really like shot up in the Industrial Revolution. Then, in the post-World War II era, it kind of plateaued off the end of the sigmoid. And now in the US, it's basically totally flat. In fact, when you look at health span, so like, longevity, your actually number of years lived plus like how healthy you are during those years, it's probably decreasing. And so I wonder, I mean, there's correlation and causation, but I wonder if this makes people a bit on edge. Like, how come with all of our technology and our medical progress, people are actually not living longer? I mean, at least on average. And, I wonder if you break that down by, income status or something like that, if things might actually stratify. So I found that that was very provocative. Another thing that I've noticed in longevity is that we're really kind of repurposing in this first kind of era of longevity. We're really repurposing existing technologies. So, companies like Prenuvo are using MRI in a different way, right? They're doing MRI scans like very often, but MRI has been around for many decades now, and so they're just using it in a more efficient and different way. And even GLP-1s, I mean, this is actually an old drug that was for diabetes, and then we came to realize that it had all these other impacts, and it's really exploded only in recent years. And now tons of patients are asking us about them, about prescriptions and things like that. I think the last thing I have about longevity is what are the reasons why it shouldn't, why we shouldn't be so hype about it. And this is someone, coming from someone who's really excited about longevity. And in what Peter Attia calls medicine 2.0, I will say there are still many unsolved problems, and we haven't totally figured out medicine 2.0. In fact, I think we're still in the Paleolithic era of medicine 2.0. I think there's much room to be done, to grow in diabetes, in COPD, in heart disease. I think there's still a lot of room to go. Those fields have kind of, especially heart disease, it had kind of a golden era for a bit, and it might be have a bit more stagnation and progress. In my own field of oncology, the rate of progress is simply just like this still, and there's so much to discover about how cancer works and how we can treat it. So I think there's still stuff to do in medicine 2.0. In longevity itself, I think we're in this like a huge era of repurposing, and I'm very excited about it. But I wonder if we have this tension because of the stagnation in health span we have in the US and around the world.
Yeah, I just want to echo some of the reasons why the others have said. I think the interest in longevity is there isn't a single reason. It's sort of a confluence of multiple reasons. But on the one hand, you have the emergence of large data sets, the AI revolution with deep learning and all these advanced AI machine learning techniques. You've got some scientific advancements as far as specific biomarkers, some promising preclinical studies with animals. On the other hand, you have sort of a mixed bag with social media influence. I agree that there are certainly legitimate quote unquote influencers that can interpret the science and can communicate effectively, but those are far and few in between. And so the other thing that I want to mention is a lot of what's sort of being called longevity, I'm going to use the same word that Alexander uses, repurposing. It's sort of repurposing the old concepts and marketing and branding them as something novel and new. And I think, we kind of go through these cycles. And on a similar vein, I sort of do agree with Sergey that, again, it takes some discernment and to figure out whether a startup or an idea is scientifically based or whether it's sort of what I could like to call 21st century high-tech snake oil, which is basically packaging an old concept that we've known about that has health benefits, packaging it with some, impressively sound technology, and then charging a premium and packaging it as longevity medicine. I think that has ways to go before it's effective and efficient and accessible.
Very interesting thoughts. And actually, I would like to ask, because you ended your talk about technology and all the hype around it, but not a lot of you mentioned AI. And I was just wondering, what do you think? Is the AI and all the GenAI solutions that appear, it is still also part why longevity is something that hyped right now because, and I'm not talking about only AI drug discovery, but also you can have an AI health assistant or wellness assistant right now with similar, like, I don't know, ChatGPT or something else. Do you think AI played a role in this as well?
Again, I can jump in, given, and Sergey is also in the AI space. So um, I would love to hear your perspectives on that. I think Gen AI has definitely put power into the hands of the user. And it has put and typically when I talk to physicians, there's been this, here's a Google Doc, right? And the physicians can get fairly perturbed when patients come in self-diagnosing themselves on Google, or they used to do that, and that would bother them, right? And I can understand why. AI-based tools have, the consumer wrappers, which are, whether ChatGPT or Gemini or Perplexity and others, have really amplified that sort of power within the hands of the consumer. Yeah, I think the community needs to realize that these tools at their current operating level are good enough. That is why these consumers are using them, right? It's funny, most physicians I talk to, they use Google too, but they don't want their patients to be using Google. And just yesterday, I had a discussion on, oh, well, the physician is more discerning. And I was like, okay, easy now, easy there, right? I mean, the importance is it puts convenience into the hands of the consumer, and these powers and these tools really help you get a lot of concurrent data, right? Just this morning, I was with one of the lead oncology physicians. She's been focused on multiple myeloma, and she's been signing up to take these courses at Harvard because she wants to learn, and she has no time, so she keeps wasting her money, right? So what's happened is physicians, after they graduate, they actually struggle to get their education up to the latest, body of knowledge in a structured manner. These tools actually help you get your education, find the latest research, be more current, way more current at a population level than a particular physician, whose knowledge may largely be frozen at the time when they graduated, right? So again, these tools amplify the opportunity to make positive outcomes for patients. There will always be edge cases where the human is, of course, an asset, to be in the loop. But by and large, for most, I think simpler mechanisms, what should I do? How should I take care? The interpretation, the empathy. I mean, you already know ChatGPT's number one use is therapy, right? So there you go. I mean, the therapists, I'm just writing a paper, with Mount Sinai, I was speaking there. They'd invited me for AI and mental health. And I told these therapists, and they were like, no, you can't be using AI. And I'm like, listen, this is the number one use case. It doesn't matter what you think anymore, right? So again, these tools dramatically change the equation of power and put power into the hands of the consumer. So I think it's a game changer.
Igor, you want to add something?
I sort of agree and disagree, Rahul. I think, I'm pretty enthusiastic about AI and technology, right? I mean, I'm passionate about data science, using data, leveraging actionable insights. That's a trick. That's the trick there. There's an asterisk to everything that Rahul just said. These tools can be effective if they are used properly in the proper context, and used in proper use cases in context. That's the issue, though, is that yes, consumers and physicians and different users of AI tools are being empowered, but being empowered is different than effectively using them in a way that actually benefits you and doesn't hurt you. There's a difference. You can be empowered to cause yourself harm. And so I think, the last part that just Rahul mentioned, that, ChatGPT is doing therapy and all these things, you've got New England Journal of Medicine and JAMA, all these string of papers coming out, with headlines, ChatGPT is better than physicians, ChatGPT is better than psychiatrists. Also realize the context of those studies. They are being tested in a very it's sort of like animal lab studies with animals. It's a very artificial environment, very artificial testing. They're being tested on a very circumscribed set of problems. And so I think for certainly if AI tools are used by patients and clinicians, they can absolutely augment certain processes and improve. But I would be very cautious to say that across the board, all these AI tools are making things better. We don't have the evidence for that. There are certain areas for sure where AI is much more superior to humans alone. For example, AI deep learning algorithms interpreting imaging in the context of radiology. That's been shown. Humans aren't able to detect certain things in radiological images that AI can. But I think the jury is still out. What is the most effective way to use these tools by patients, by clinicians, and how can we have synergy between human and AI tools so that we maximize the benefits and minimize the risks?
I tend to agree with Igor. I think all of us are excited about AI. Obviously, many of us are in this area. A lot of great advancements, but we have to be careful. I actually looked at many of those AI outperforming doctors' papers, and I debunked them. And it's usually something very simple, like poor statistical techniques, or cherry-picked benchmark, or contaminated testing set. Like some very simple, sometimes benign reasons that are used by some of those big companies like Google and Microsoft to make their point. But yeah, AI is the future. I actually did a spreadsheet of companies, AI companies investing in longevity. And what's interesting is that we're all talking about prevention and trying to maybe have some early detection, diagnostics, things like that. But a lot of companies in this area, actually, there are not a lot of them, and many of them actually made really horrible news, like Theranos, Babylon, Forward. They're all in this detection diagnostics. They're either cheap blood tests or or some other areas, trying to develop something preventive. And it's funny. I think the science is there. It's just that the business proposition is not there yet, and we have to think hard how to fund some of those projects, because right now, from what I'm looking at, these companies, none of them are making money. Even the ones that are developing some really exciting techniques like RNA, mRNA, regenerative medicine. A lot of companies on my list I'm looking at right now, and I'm trying a hard time finding companies actually making money. I think it's in my opinion, we have to go beyond just venture capital and just investment in general and talk about policy, because it's something that's affecting all of us, not just Silicon Valley or some rich dudes with who are willing to pay $250K for whole body scan. I think it should be affecting all of us. I think it's a policy question, because if we solve longevity, it's humongous savings to the whole economy, not just sort of to specific individuals. And so we have to talk about it in terms of policy, in terms of Washington, and how we apply some of those rules and regulations, maybe.
I think I agree with all of them. And I think, AI might have a dramatic impact in longevity. I wonder if it's going to be actually most in how we do research. And so how do we discover new medical technologies? I'm really excited about how, I do, for example, some lung cancer research. I studied how the different mutations impact like the tumor microenvironment and prognosis and things like that. And I just wonder, like, will AI be able to accelerate the types of research that I do, accelerate drug development, discovery, things in cancer? And might we be able to push the cancer envelope? And, cancer in North America is like always neck and neck with heart disease. And if so, we reduce cancer mortality, longevity. So that curve of life expectancy is naturally going to start to pitch up again instead of being stagnant. So I think research is a big way, which I think longevity will start to improve. It's just that it's going to take, probably a decade before we start to really see these improvements come in over time, because, it's still drugs that are being discovered with AI today and in the past 5 years, it's still, we're only going to see the impact of them on a population health level in, the next decade or so. So that's kind of the first way I wonder it might impact longevity. In the second way, we're talking about how, patients are starting to be empowered to use ChatGPT, to use, Gemini and other sources to figure out, some of their own diagnoses. And as a physician, I think, at least my generation of physicians, we love this. Like, we love that patients are coming empowered, with, some of their own notions of what might be going on. They might have a gut feeling, and they might, compare it with the AI, and then, provided you have enough clinic time, you could have a nice discussion with your patient. And I think that's just really wonderful. And then, as a physician yourself, using I just, did my internal medicine board exams, and, internal medicine's a far-reaching specialty where you learn about many different facets of patient care and different disease pathologies. And post-board exam, I feel like I have enough confidence to say, I can put in a sketch of a patient, anonymized, of course, and, and see what it says. And it's a good way to expand a differential diagnosis, rather than coming from, an area where I have nothing, I don't know what's going on. And, when you're board certified, knowing what might be a hallucination or what might be very dangerous to give to a patient, I think is very powerful. And so you can kind of sidestep by having a physician around some of the perils of ChatGPT telling you, a mega high, anticoagulation dose, for example, that would be unsafe, and you can kind of spot check those things. I guess really the final thing is I wonder about making healthcare more equitable and more economical. Especially in the U.S. where there's a huge admin cost. The other thing I wonder is, just can we administer Medicare and Medicaid more effectively by using AI? There's just a huge amount of bureaucracy around healthcare, and for good reason. I mean, it's a complex thing to deliver. So those are some of the ways I think longevity might be modulated by AI.
And then Alexander, actually, on your point on oncology, right? I mean, I don't know if you've caught the news, but Isomorphic Labs, which is this Google-funded startup, spin-off rather, they're now planning. So they've been working on an AI-generated drug for cancer. So they're potentially looking at starting clinical, phase 1 trials, actually human trials. This year. So they haven't announced what the particular target is, but
That's fantastic. I think everybody in oncology is always excited about what might we be able to do to do better by our patients, and that's really one of the motivations for going into this field. So I love to hear news like that.
And to my little note about it all is, no matter what any of us thinks, the reality is AI is absolutely taking over healthcare. And, we could try to gatekeep it, and we could try to tell people what to do and what not to do. But I think the reality is we have to learn how to deal with the fallout, positive and negative. And I even see doctors, it's not just patients misunderstanding the results from queries. And the solution to that is to try and educate as many people as possible. I live with my partner as an AI scientist, and so we do extremely boring sounding things like watch educational videos about how LLMs are trained. And so that's how I have grown to understand, like, so certain mistakes or confabulations, hallucinations are made for this reason, and how you have to query a certain way. And I actually think that that's actually perhaps more valuable than even, I say all the time, what's the difference between a doctor and a patient asking ChatGPT the same question? Is the doctor knows what context to give to the LLM, but there's an additional layer is somebody who is equipped to understand how the LLM responds and exactly why they make certain mistakes. That's the most powerful prompter of all. So I think in a way, it has promoted the longevity revolution, but it has in general promoted more autonomy and sovereignty of health in general. More people feel like they have more control. And I think maybe some folks out there have probably seen the recent studies about how, how Google is cannibalizing their own search results, and SEO is changing all over the place. So health websites is actually the category of websites, the industry of websites that has decreased most in terms of their visits because of AI. And I think it's most likely because people are querying the LLMs themselves.
Yeah, and just to follow up on that, actually, there was recently made a post. There was an article, I don't remember which publication, but showed that overall health searches went over the past, I believe, year, health searches went down by 15% across all 15% across all topics and 30% in health specifically. And which for the most part is attributed to using these chatbots. Now, just to follow up on initially what Hillary said is just that I don't think it's about gatekeeping. I think it's the reality is AI tools are here, they're going to progress. But I think the key is awareness, education, just like we all probably would agree that health literacy and scientific literacy is relatively low around the world, even in countries like the US. The same thing applies to AI and tech literacy. So I think it's important to just continue with health literacy education, helping consumers use these tools in a responsible way. Because in some ways, while these tools are very powerful and empower people with their health, if used incorrectly, they can actually cause more harm. And for example, with a Google search, you go to the source, you can tell where that information is coming from. You can tell whether it's a peer-reviewed scientific journal or a blog or some dark web, dark corner of the web with an anonymous source. In many cases, with these AI tools, I basically see them as advanced Google search. It doesn't create any new knowledge. It synthesizes the knowledge that is already published. The problem is that just because of the nature of how these tools work, they're generative. They synthesize information. They do not provide direct sources where you can verify the information. They often provide information and sound very convincing. So a typical user that doesn't know doesn't understand how these tools work and doesn't have the background, the expertise in the area may very well believe the 95% of information that is true, and the 5% of information that is provided in a convincing manner but false, but may end up causing harm or death to the patient. So I think we just have to be careful how these tools are deployed, how they are used by consumers, and as long as consumers knowingly understand the benefits and risks, then I'm totally fine for people using them.
I want to add to what Igor just said that one of the problems with there are a lot of positives, obviously we've talked about it, but one of the problems is by design, transformer-based models like modern LLMs, they have really hard time. It's really hard to train unless you specifically have some limits or constraint on them, but they have issues saying, I don't know, which is a very dangerous thing in medicine where it's a very, very productive answer when AI tells us, I don't know. Current LLMs, they always need to say something. They always need to have an answer. This is how they're being sold. So for the AI vendor to sell you something that maybe 30% of the time says, I don't know, as it's supposed to, is a very hard sell. But this is what we need to understand. I think previous generation, they were maybe not as accurate, not as powerful, but they're a little bit better in that sense that we know when it's making an error, and it's very informative. So, yeah.
I'm smiling because that's just like with medicine. One of the best way to tell if you're talking to a great doctor is if they tell you they don't know. But everyone wants to go to a doctor that gives them a straight answer.
Oh, I was just going to say, I think great doctors are really humble. So, and I think the same way, great AIs are also probably very humble as well.
You guys brought some really important points. We're halfway done with our podcast, and we went through our first question. So way to go! No, but I'm kidding. Really, some important thoughts. But actually, I want to take a step back and talk about terminology for a sec. Lifespan, health span, disease-free years, biological age score, organ age. Which metric do you use, and why does that vocabulary matter to patients and investors alike?
So I think, my top two favorites are lifespan and health span. And I think as Igor had pointed to earlier, right, we want to not only enhance our lifespan, but also have a health span which matches it. So lifespan is just number of years, and health span in a way is more closely tied to, your disease-free life years that so where you have a healthy life. So ideally, you want, what's happening is in the US, for example, average lifespan is about 78, give or take, pre-COVID, post-COVID, take your metric. But health span is about 63. So that's when certain comorbidities start off, with most people. So whether it's diabetes, cardiovascular health issues, or cancers, or whatever. So 63 is that age. So for 15 years, people are being sustained, and they're in a lot of pain. So there's a lot of pain management, there's anxiety. I mean, there's a lot of things. And what people don't realize, it's not just about the person who's, the responsibility to maintain a health span is not just for the person themselves, but it impacts greatly their family members, their friends, and so on and so forth. So, so I think the implication of health span is not just for an individual, it's also to society. So ideally, you want large lifespans. So you want to go beyond 78 to, in our case, we would love to be 150, but we also want health spans to match the same. And the research shows that if you hit about 90, if you cross 80 without, on your health span, without comorbidities and diseases, that again sets some sort of an escape velocity to become octogenarians and others. And the blue zone studies across Okinawa, Ikaria, I mean, they all show these similar metrics. So again, you want health span, and you very closely want to track and impact, lifespan. So those are my top two favorites.
Yeah, and just quickly, an easy way to think about it is quality over quantity, right? Quantity is the number of years you live. The quality is whether you're enjoying those years or not, right? Whether you have chronic disease, whether or you go into the emergency room for, strokes every 3 months. There's a difference, right? So
I have 2 points here to make. One is, as the woman in the room, Zoom room, women, there's a drastic difference. Women, of course, live longer on average, but we also live sicker for longer on average. So it's an interesting disparity. And then the second point that I want to bring up is health span is such a subjective term. On the one hand, you could say it's freedom from certain chronic diseases, but again, that means we have to refer to essentially disease codes that we've invented for reimbursement by insurance companies. And so it's subjective. Like, what does it mean to live in good health? And that changes for an individual, and it changes for the generation that you're born in. Prior generations, for example, were used to feeling pain chronically in their older age or whenever. They didn't have a lot of the solutions we have for convenience and pain-free living that we do today. Now, my partner can barely survive the day without the AC on. So and then I heard him yell at me through the wall just now. He heard me. So, and then another point is that we don't know what the future brings us. Perhaps right now, like we envision, life isn't worth living if we can't pick up our great-grandchildren or hike up a mountain. But we're facing a future where we might live incredibly valuable lives connected to a computer through our minds or something like that. And so we just can't define today what we might want tomorrow. And so I think the definition of health span is not so easy to define as perhaps just lack of illness.
Now, Hillary, you make, I think when you talk about the male-female paradox, on the health side and the lifespan side, I'm wondering if there's also variables which have been primarily designed with male physiology in mind. That's actually, that prompted a thought, which is, could it be exasperating the situation?
I actually always assumed that there was a simpler explanation, which is that we spend something like 4% of research dollars on women's health and barely study women. So we are lucky enough to be, given estrogen for much of our lives naturally, and that promotes a great deal of health and prevents a lot of disease. And then we hit menopause, and then everything goes downhill very, really rapidly. And that withdrawal actually induces a lot of disease too. So we don't talk about that. It's like the speed at which that happens actually impacts us very strongly versus a man. Men also, men have lots of decline of various things, including hormones, testosterone, and so forth throughout your life, but it's a bit more gradual. And so you don't see that as dramatically the same way that you see it in women. So
Alexander, I'll forward this question to you as a medical professional. I hear a lot about organ age. What do you think? Like, is that a thing? Should we pay attention careful to this? Because there are cases when people say that, oh, my brain is a decade older than my heart, for example. Should we pay attention to this?
It's such a great question, and I was, I prepped for a talk to do biomarker age about like 2 months ago, and so I did like a big lit review, and there have been all these different like age markers to calculate your, kind of your biological age rather than the age that's on your driver's license, and people do this like age gap, and so age gap is what's the difference between an age that we measure by like how old you look like in your bloodstream, like the proteins, or how old you look like on an MRI, like a brain MRI, versus the age that's on your birth certificate, or that the government knows. And so we call that the age gap. And so I think for some time, like people have been talking about this age gap that you might have, but recently there's been this provocative idea, which is that might there actually be an age gap, a delta age, for each different organ. And so we know that, for example, in Nature Medicine in 2023, there was something called protein age or prot age, and they had this thing called prot age gap. And this is one of the stronger papers that I've read about, using proteins and circulating in the blood to calculate age. And they didn't do it on an organ-specific basis, but they were able to show that the protein age gap correlated with different comorbidities or the time to onset of comorbidity or morbidity for different disease groups. So like neurodegeneration, like Alzheimer's, or different sorts of cancers, or kidney disease or diabetes. And so you had, endocrine disability, you had, cardiac disability. And then the next leading question is, can you do it by organ group? And your timing of your question is actually really interesting because in Nature Medicine, actually just published on July 9th, and I was just Googling, before we had our talk today, but on July 9th, this group from Stanford published an organ-specific age marker. And so, it's quite provocative and interesting. And so what they try to do in this study is they use the UK Biobank, and they try to calculate an age for each of your different organs, and they try to correlate that with disease. And so I really think this is kind of the latest frontier in these biomarkers of organ age. And what is this actually going to help anyone? Is it going to be useful other than just an academic exercise or something to be interested in as a patient? I think it might be. I mean, if your age of your kidneys is going to be poor, might you consider going earlier on a nephroprotective agent like a RAS blocker, or might you do an earlier referral to a nephrologist, to a kidney specialist, to better protect your kidneys? And if you know that your brain might, the age might be lagging, might you have a really frank discussion with the patient about, mitigating some of the risk factors that we know are associated with brain aging, like, alcohol use, like smoking, like diet, like exercise, certainly some of the modifiable ones, and there's a ton that are non-modifiable. So I think this is a really, really exciting field. And me as someone who did biomarkers in my PhD thesis, like this is what really I care a lot about. So yeah, I think it's a great question.
Igor, you want to add something?
Yeah, I mostly agree with what Alexander said. So I think, definitely this is an exciting area with often associated with longevity medicine, these biological age biomarkers. And, you can have, as Alexander described, whole body sort of person, biological age, and then now you have these organ specific variants. Now, just something to keep in mind is the vast majority of the studies that have been done on this have been done in animals and in petri dishes, mostly preclinical work in rodents or in petri dishes with either animal or human cells. There have been, over the last several years, there have been an increasing number of human studies, But even those studies, for the most part, are correlational. They're associational. They're these analyzing these large proteome databases, these large clinical data sets, either electronic health records, or whether associating, these biological age biomarker with various sort of various other things. We haven't had very many prospective longitudinal studies. And so to me, it's absolutely an exciting area. It's something that I pay close attention to. Whether it will actually make a difference is up in the air, because the way I think about it is, you've got, and this is the challenge in this digital age, is that clinicians and patients are going to be inundated with all this data. Not all data is insightful. That is, not all data provides insights. The data that does provide insights, not all data with insights is action. Not all insights are actionable, meaning you can measure, just because you can measure something doesn't mean you can do something about it, take some sort of an action. And not all actions are meaningful or impactful. So there's a long chain going from data, a heart rate reading that your phone might tell you, and actually going all the way down the chain, and you using that information in a way that actually makes an impact on you improving your quality of life or your longevity. And so now, I look forward to those studies where these associations that have been published across a variety of papers are validated in prospective trials. I think that will be interesting to see. There may also be different types of variants for aging biomarkers for different populations. I think when we're in general talking about longevity, we sort of talk about everybody, but there are people that have cancer and they have Alzheimer's. They deal with some very severe, difficult chronic conditions versus sort of the worried well. They don't have chronic conditions. I think the approaches for longevity are going to be wildly different for those groups. And so similarly, there may be different types of age of biomarkers. But anyway, long story short, I'm excited, but I'm cautiously optimistic, but I'm waiting for the prospective validation trials, because right now it's just correlational. It's exciting. Let's see.
To that point, I love that, because I often write about how certain diagnostics lead us to mostly confusion and adding to a lot of noise. But, I'm the opposite of, being a naysayer. I still think it's very exciting. And I think it's more about informed consent. It's people who are getting these types of diagnostics, these tests, should understand that we don't really know what to do with that information. But we have to start with getting the information, and then researchers will help us understand what can we do about these insights. So to your point, I think that's extremely valuable. And back to the whole concept of biological age, I also was just writing about this. It's my birthday week, and I was thinking about biological age and the many tests, and it's kind of a misnomer, because what we're getting at is at the root of whether a system, an organ, or your body is healthy. It's really a health score, kind of like how companies make up these sleep scores. And I say make up because every single score you come up with, every biological age you come up with, is going to differ from another algorithm, another research lab, another company's. And so it's very hard to understand what is right. So I view it as you get a bunch of these biological ages, and, of course, choosing the ones that have been validated a bit more, have some theoretical validity as well. And you use that as a general compass to understand, okay, this person is clearly not doing well. There's something underlying that needs to be fixed. And then you turn in the correct direction. But I buried that in there. We talk about organ ages now, but I actually think it's also important to recognize a lot of times the research is in system age as well. And I say that because when we think organs, we think like a solid organ of some kind, and the lung or something, or the heart. And really what's probably most valuable to think about is how different systems in your body are aging or degenerating, or the health of that, like your vascular system, your cardiovascular system. And at the end of it, these are all, again, like a lot of clouds, and we're just trying to make a shape out of it to determine what to do.
The organ aging, and Igor, you touched some of these too. And yeah, what's the perspective? I mean, I'm wondering, with already on the kidney side, for example, with GFR data, with MRI, there's already talk in terms of that impacting donor lists, or and again, I think, Hillary, as you were saying, researchers are now starting looking at it, and they'll figure it out. I mean, it's going to be a fascinating, it's a kind of a fascinating unknown area that we're probably skating into with implications.
Well, that's a very interesting and important point, Rahul. It's, we're talking about sort of the clinical and the scientific aspects of these things, but the other thing that I think Alex mentioned, others, is there are societal and ethical issues for AI, for medicine, for all these technologies that shouldn't be an afterthought. These should be proactively developed along with these technologies. So, for example, as Rahul was speaking, he said, so just think about this. Is an insurance company now going to go and analyze your biological age and deny you and increase your premiums based on that? I mean, just think about the long-term implications of these technologies, even though these technologies are far from being completely validated. So they are very exciting technologies, and I think, again, I'm cautiously optimistic that they can make a positive impact on healthcare and on people's lives. But if done the wrong way, they can actually cause more harm. And so we, as people who are passionate about this and interested, I think it sort of behooves us to speak up or share opinions when we think, a company isn't doing it in an ethical way, or, we all know all of those companies, right? I'm not going to mention names, but there are certain companies in the tech world that have a lackluster ethical record, let's just say. So
this is super interesting, but we got to move on. I really want to ask this question, which for me personally, I think that's the most important question today. Might be wrong again, but I'm going to refer to Eric Topol, who almost joined our podcast, and his latest book, Bestseller, Super Ageist. And he basically says that there's still no scientific evidence that all those supplements, for God's sake, plasma swaps or other things, they actually expand your longevity in your lifespan. So what he basically says, science still continues to prove that the most important things are diet, sleep, and exercise. So first question to you guys, do you think we even should focus on other things and all the new research, or should we continue promoting healthy lifestyle among all of us? Because obviously this is what helps you the most so far, and that is evidence-based, but we still keep talking about all kind of things, all kind of pharma drugs that can help you cope with your behavior change. But at the end of the day, you got to take care of your health, which is the most important thing. Sergey, what do you think?
Yeah, actually, Eric Topol also was talking about super agers. So those are the people who have their mental capacity preserved into their 80s and 90s. He was saying. So I have an anecdote for you, Alex. So you mentioned I just came from Europe. So I've been to Lithuania and some other countries, and to me it's a bit of a shock, because Europeans, I don't know, in my opinion, a lot of them, they just don't give a shit. They live their daily lives. They smoke much more than Americans do. They definitely drink much more than Americans do. So they seemingly have this unhealthy lifestyle, but then they just don't give a shit. So like mentally, I think they're so stress-free, a lot of them. They have their families. This is their, seemingly, at least in my opinion, this is their number one thing. They go hiking maybe during weekends. So they live like week to week. They don't care about all these biomarkers. They, nobody's talking about that. They're nobody's talking about longevity, at least, maybe people I talk to, maybe there's a bias there. But so anecdotally, I feel like in the US, like we should be paying more attention to mental health, as opposed to maybe developing certain drugs, paying more attention to the lifestyle, as you mentioned, exercise and all those good things. They definitely have a big impact, as opposed to maybe even the best drugs out there. I think we should be ashamed in America that we have the worst maternal health in all developed world. Maternal morbidity is just awful. We shouldn't be having that in the most developed country in the world. Obviously, opioids are a big problem that affects longevity, at least on average in this country. So I think you're absolutely right, just sort of anecdotally, but also like research based. There are a lot of things that we should be paying attention maybe day to day, is basically just having healthy lifestyle and preserving our mental health. That's what's, in my opinion, the most important thing.
I can't agree more. I'm so glad you brought that up, because I was going to say, of all of the things that a lot of longevity startups promote, they really don't know how to address mental health, because it's not tangible the same way other things are as much. My prior company before CareCore actually was a mental health company, because I saw this as the biggest gap. But truly, it's a very difficult area to commercialize, and therefore I think there's a lot less attention, because America is the most capitalistic country possible. And so I think that's a big part of it. And also, to the point of, whether we should just help people focus on lifestyle, et cetera, versus all these other things, I think it's a balance. So I always tell folks, you want to major in the majors. You don't want to major in the minors. People tend to want to go crazy with biohacking and wearables and supplements, because those are the minors that are very tangible. You can see a pill. But by the majors, I'm talking about the lifestyle things. And the reason why they're so hard is not only because it's habit, it's what you do every single day, and it's not as tangible, but also because you have to change your literal entire life. You have to make hard choices. Like you brought up, Sergey, Europeans focus so much on their community and their family. Can you imagine most people we know in America actually focusing on community and their family? And so it's a little sad in that way, that that's the kind of society that we live in. We've kind of lost sight of the human in the midst of all of this biohacking. So I definitely don't disagree. And I guess my one positive note about all of these other things, other than the big five or so lifestyle type pillars, which are absolutely the most important, is that we do have some hope in our generation of, the next 30 to 50 years of making a mark on ultimate lifespan, maximum lifespan. I agree with everyone who says that we have nothing so far that is proven to extend that maximum lifespan, but it doesn't mean that we never will. And I actually think that we are at the cliff, at the right before the crux of the breakthroughs, and partially because of AI, partially because of just how broken healthcare and research is today. There's going to be a major disruption over the next few decades. So I would tell people practically, speaking, if you're listening, major in the majors, focus absolutely on your community, your relationships, your mental health, and then, of course, what you eat, exercise, and sleep. But don't lose sight of the fact that things may change in a very dramatic way within our lifetimes.
I think this is a really great discussion, and when we talk about those pillars, I find it very fascinating, and I ended up talking like even in the oncology clinic about some of these pillars as well. Like we know that just germane to oncology, like there was a clinical trial called the Challenge trial that was presented at ASCO, it's the big oncology meeting, just like a month and a half ago or so, and it showed that actually exercise reduces cancer recurrence in colon cancer for people who have been treated. And I find that to be quite amazing and provocative. And then it's just kind of like time and time again, like these studies keep coming up, like, certainly exercise is correlated, anti-correlated, with dementia. But I wonder if it's, if all of these things like the sleep, the exercise, the stress reduction, having happy and positive relationships in your life, wonder if it's scratching the surface at something a bit deeper, towards the core of like how humans are meant to operate. Like we're meant to have these lives, like, having good relationships, like taking care of our bodies, being active, being outside in nature. I wonder if there's something very fundamental to who we are, that this is actually, one of the healthiest ways to go live through life. And talking about Europeans, my family is from Europe, even though I was born in the New World. And yeah, there is something a bit interesting about being with your family, and maybe that community aspect, and walking to work every day, being outside. Maybe they can be forgiven a little bit for smoking probably just a bit too much. Although they'd be even healthier if they didn't smoke, to be fair. And then so I think a lot about those pillars, a tremendous amount. And then I still really believe in this concept. I mean, obviously I'm biased because I'm a physician, but I really believe in this concept of like, let's just like also continue to work on medicine 2.0. Like, if you do all of those pillars, like you're totally optimized, like you have you have like all of your exercise trackers, like you might be going to a longevity doctor, you might be super optimized in everything, but then you get leukemia, like you're still going to pass away from the leukemia, right? And so there's still or you have terrible diabetes because you're unlucky, or you might have type 1 diabetes. Like it's so critical to have really excellent care for, true proven pathophysiological processes within your body, and you still can die for those things. And so even more so, I do like thinking about how can AI improve medical research to better tackle these pathophysiological processes. And I think that actually will make a really big impact in health span that we'll see in the coming decades. And then again, just when we talked about, Sergey, I loved how you talked about the maternal mortality rate. Like there are health disparities, and like there are people who are not getting like medical interventions that have been around for like 50 years. And so on a population level, by using AI to distribute healthcare to more people, like will just increase the population level health span by virtue of that. So those are some of the like the non-hype ways in which I think AI might modulate our health spans. And then once we hit those things, like again, I love majoring in the majors. Like then that final 5% of, oh, might this supplement, or might this exact workout routine, or this AI coach, maybe that'll get you like a few more percentage points. But I think the major things couldn't be more clear. And so and to the extent that AI can help us with those major things, I think it's fantastic.
Yeah, and just to echo what Alexander and Hillary said, sort of similar things. I think there's the people, especially in the US, I've noticed are very distractible, and it's easier to get swayed by new technologies. And people want an easy solution. They want to take a pill to solve all their chronic health problems, and we haven't, fortunately, unfortunately, we haven't discovered an easy solution yet, right? So I think we should continue in parallel to develop the AI technologies, the data science, the new biomarkers, have those technologies validated. But I think we have to, the people shouldn't lose focus of where there is evidence. And the evidence is again those pillars that were mentioned. It's the sleep, it's the physical activity, it's the nutrition. Avoiding, America is notorious for processed foods, that the problem is much worse here than in Europe and in some other countries. It's the social connections, super important. The Harvard study of adult development, the longest running study on this topic, over 85 years, have found that the single most important factor that predicts long and happy life is quality relationships. Nothing else even compares. Mental health was mentioned. As a neuroscientist and with background in clinical training in psychiatry, I can't agree more. So mental health is sort of, sometimes it's hard to put a grasp on it. In fact, for many years, there was no parity with physical health. Insurance companies wouldn't cover a lot of mental health conditions, but the numbers speak for themselves. Every dollar that's invested in mental health reduces healthcare spending overall for physical health by $1.60 some cents. So there's an economic rationale for doing that. depression is the single most, depression worldwide is the number one morbidity as far as decreasing the quality of life worldwide. And so, all these things are important. Obviously, reducing harmful substances like alcohol consumption and cigarette smoking. But, to the extent that the emerging technologies like AI, digital health, brain age, aging biomarkers can empower people to focus on the pillars, I am enthusiastic. But we just have to find the right way to implement these new technologies so that they can empower people to focus on what matters.
Yeah.
People should be focusing on the 80% that's really important, and we can continue making progress in the 20% that sort of still needs scientific evidence and technological development.
Broadly speaking, agreeing with you is that I think the general public, people who want to take action on their health today, is focused more on these majors, the pillars, and yet they're distracted by all of the edge scientific things. And I would argue that scientists should refocus, yes, we still need to solve some diseases, but actually we need way more funding and effort into biological therapies and technologies to help with the aging process, the degenerative process itself. And for those who are listening, you're probably familiar with, because aging is not considered a disease, funding mechanisms for it is a convoluted process. It has to get funded oftentimes by private specialty type groups. And so I actually think there needs to be way, way more research, like real research dollars, not like necessarily just all of us trying to biohack and research that way. And we need true hard research being done in laboratories to really push the needle at the edge, the maximum of longevity. And that is what research is absolutely for. And then the rest of us can take the practical actions that we all know to be true without worrying too much about the details. Like, I tire of all of these social media wars between this or that diet. Like, the specifics, people get so worked up about, but generally speaking, everybody knows, generally speaking, what is a solid amount of sleep, what is a good diet, and, moving is good for you, community is good for you.
Generally, I think in the ideal world, people would sleep well, eat well, and move, have family and social support. But the reality, especially in Western countries, the reality is that many people don't do that, right? So I think I don't like it, whether it's in politics or in health and science, I don't like extremes. I don't like, you got to do only this or you got to do only that. The reality is many people don't do things that they're quote unquote supposed to do. So do I think it makes sense for some people to have surgery or take drugs developed by pharmaceutical companies? Yes. In some cases, they are life-saving. In some cases, they do improve quality of life. And I don't think it's one or the other. I think as long as patients and clinicians are together making informed decisions and it's grounded in science and evidence, then that's fine. But I think I don't like these kind of like Hillary said, there's social media wars, right? You've got influencers who are peddling and promoting their own coaching, and they say, oh, all pharma is bad. They just want to profit from you. Well, I think that's a very simplistic way of looking at it. I look at it a different way. I've worked in academia and on the front lines of healthcare and pharma, and I can tell you most pharma companies and the people that work at these companies are some of the most ethical and grounded people that really want to make a positive difference. Now, is pharma perfect? No. They've made a lot of mistakes. They've done some bad things. They do some shady things. However, as a whole, my view on pharma and biotech is different. Pharmaceutical companies are responding to a need. The need is that people don't follow lifestyle choices that they should be. They develop chronic conditions. That necessitates another solution, and that's where a lot of pharmaceutical drugs come. Obviously, there are also drugs that are used acutely for, a stroke or a seizure or an injury of some kind or infections. But for the most part, pharma companies are responding to a healthcare need where people develop chronic conditions and they want some kind of a solution. They want a pill or they want a surgery. Some drugs work better than others. No, most drugs come with certain side effects and adverse effects, and it's always a matter of balancing risk versus benefit. So, I sort of looking at the big picture. Any influencer that just blank out says big pharma is bad, they just want to make money off of you. Yeah, it's a business. They do want to make money, but I can tell you most pharma companies and most people there are ethical and they want to do the best thing they can. And there is no industry like pharma with the regulations. So they're regulated up and down in every way possible. So I can tell you it's not that simple.
Yeah. You mentioned influencers a few times, and a quick question to you guys. People like Bryan Johnson, do you think this is a good thing for bringing attention to longevity, or not that good thing? Because yes, he's kind of provocative. He can talk for hours about his 3-hour erection at night, and he can bring more attention to that. But do you think he actually brings some value to this niche, or not really?
I will say, because I live in the world of longevity physicians who have, backdoor conversations about how much they love or hate certain influencers. And the reality is, I think a lot of people who hate on some of these influencers speak from a position of some envy because, people aren't listening to them, is the truth. And I've met Bryan Johnson, and I don't think he says everything that's factual or correct. He makes lots of mistakes, and he's certainly not right, and he's perhaps done some harm. But overall, I think he's coming from a position, at least he believes, to be ethical, and he thinks he's doing right. And for what it's worth, I think it's brought a lot of attention to this field that we couldn't have gotten it other ways. And so I kind of take everything as a will. Everything is a tool. So just like medications are a tool, supplements are a tool, lifestyle habits are a tool, communicators such as creators, influencers, and so be it, they are tools as well. And we try to navigate ourselves and our patients through this maze of tools to figure out what is right for them.
No, I think that's a great point, Hillary. I think you captured it really well, that these influencers are tools. And I think they draw more attention to the importance of these core issues. And so I think we all become more sensitive. It's like a variable. A variable may not tell you what to do, but the reason they do work because they drive behavioral change. Because I think, Igor, as you mentioned, behavioral change is the difficult part, which is why pharma exists. So, if more and more of such tools, such influencers, they draw attention to the importance of some of these key facets that impact health, well, that's perfect. I think that's a good thing. And whether it's Huberman or it's Sinclair or Atia or whoever, I think inherently they are also looking at it not just from a business perspective, but also from doing the right thing. So I think that's an important facet that does exist within this industry. I don't think anybody inherently wants to do something bad.
I'll just add from my personal view. I think and talking about Bryan Johnson, I think his data-driven approach is great because he says, don't take any supplement just because it's hype and everybody's taking it. Take only the vitamins or supplements according to the data that shows that you need them, and track the data all the time. And I think this is important insight that he brings to the industry for sure. Unfortunately, we're running out of time. I'll ask each one of you to say one thing that you want all our viewers to take out of this podcast. What is the most important thing about longevity, lifespan, health span that you want our listeners to remember out of this episode?
Just continue preserving your healthy lifestyle. I don't think there's a magical drug that could help you in a big scheme of things. That's kind of like my opinion from what I've seen in research and popular press. And another thing that I wanted to say is that, because I think somebody has to say it, that as I'm looking at funding of especially research on longevity, I just don't see how that's going to come from private sector. Whenever it's privately funded, there's usually some benefit to that particular organization or corporation. If we want an independent, unbiased research, I think we need to support efforts like NIH and FDA. And unfortunately, right now, in my opinion, that's not the best of time with dodging and reducing funding for those organizations. So I think we have to, I guess, pass this, in my opinion, negative time for longevity and other healthcare areas, research funding, and hope that that's going to change in the future.
So if I may build on, some of what Sergey said, but I think longevity is, I think too many people think it's a genetic lottery, or it's some sort of a Silicon Valley biohack, or it's a number on a birthday cake. And I think at least this entire discussion, what it seems to reveal is that the big unlock is around your daily micro decisions, right? It's when you eat, how you move, how you recover. And these are largely modifiable, they're trackable, and most importantly, these are deeply personal. So you need intelligence in your habits, not in your hardware. And I think that's one of the key things that I'm taking away. And with Live 150, which I'm leading, that's exactly what we're trying to do.
Yeah, and I'll echo that, what Rahul said and what everyone says. It's going back to the fundamentals and the pillars. Definitely maintain curiosity about the emerging technologies, read the scientific papers, make sure if you're not in the healthcare or science field, make sure you have a healthcare professional in your corner who you can consult with, or a scientist who you can go into and say, is this legit? Can you read this paper for me and tell me if what they're saying makes scientific sense? Is there evidence? But focus on the fundamentals. And, with respect to brain and mental health specifically, which is the area of kind of my focus, is the Lancet Commission has every number of years comes out and they estimate sort of they look at modifiable risk factors specifically for Alzheimer's and dementia. And the latest, I believe it was published last year, is that up to 45% of Alzheimer's and dementia cases could be prevented through a series of something like 12 or 14 modifiable risk factors. So obviously, it will take work to work on those risk factors. And if it was easy, we wouldn't be here, and pharma companies wouldn't be making profitable drugs, right? So, but don't feel at a loss. There are things you can do. Take baby steps. If it means you're going from sitting on your couch to walking 5 minutes a day, then do that. Because the 5 minutes that you're going to walk is going to be better than you sitting on a couch all day. Then you can work your way up to 10 minutes and maybe doing a bike ride or maybe walking with a friend. Start somewhere and make progress. That's what I would say. And enjoy life. Enjoy life with the people you care about, because that's ultimately we all go to one place.
And that place is my home for chai. No, I'm just kidding.
Maybe the Amalfi Coast, I don't know.
Oh, I would enjoy that. I was going to say longevity is resilience. And I think some folks get very obsessed about all of the tips and tricks that they read about online, and they start trying to avoid everything, like the microplastics, the electromagnetic fields and pollution and everything. And at the end of the day, it's about building resilience through hormesis, which is controlled stress. So I often tell folks, if you remember nothing else, it's the 10% rule, which is challenge yourself 10%. And like Igor said, maybe that 10% is getting off your couch, because that's where you're starting from. And for other people, it's pushing a little bit farther in a more perhaps extreme way. But for zone 2, for example, it adjusts as you become more fit. And so it's about trying a little harder, just that 10%. Don't do the extremes. Don't go from 0 to 100, because that's how injuries happen, and that will set you back a long way. So longevity is building resilience for the long term.
This is great. Alexander, wrap us up.
Yeah, I think there's a bit of a premonition amongst the group, but we're all converging on the same idea, and I can't echo it enough. I mean, with my patients, that often when I was doing internal medicine, people would come in with like a heart attack and they were smoking and all of these things, and life is very complicated, and I don't think people, really went out to start smoking in the first place, or really went out to be unhealthy. Like, we live in a very toxic environment. There's processed food. Many of us live in the suburbs. You have to walk everywhere. We live in places with poor weather, or, we live all alone. We had to move for work, etc., whatever it might be. I think sometimes we're so hard on ourselves, right? And even some of our physicians are hard on us too. We say, oh my God, you shouldn't have smoked, you shouldn't have drank all of these things. With patients, like, I think what a lot of us talk about right now is just be kind to yourself. Like, just give yourself some grace. Like, you don't have to quit smoking tomorrow, but like, just give it a shot. And we know that the people who quit, like, they've tried like 40 times. Like, honestly, like, they tried so many times, and then, finally it's that one time that makes a real difference. And so what I would say to anyone is just be kind. And yeah, getting those, whatever, 5 minutes in the gym or the walking or whatever it is, we know all of that is better than really doing nothing. And I think also, like, is it all worth it? Is living longer worth it if we're going to make ourselves stressed out? I don't know, actually. And again, like, I think these pillars really do scratch, at something deeper, at something about, what makes us have a meaningful and fulfilling life. But being, with a community, having a sense of purpose, having, amazing relationships throughout our lives, like we saw in the Harvard study, eating really delicious, but also like fresh and nutritious food. And then like being out there and being active and like getting outside. Like, I really think that some of these things are at the core of what makes us human and what makes a life worth living. So, I hope everyone listening to this has a long, healthy, and, happy life, but I hope we're all kind to ourselves.
Thank you so much, everyone. I love this episode. We did not get to most of my questions, so I think we should meet again for our second episode on longevity. But thank you so much. Really appreciate your time. And yeah, let's stay in touch.